In-depth coverage of the top stories and breaking news when it happens. News Radio 1080 KRLD.
The president announces another group of workers has to be 100% vaccinated or they don't get federal money. This involves long-term care facilities and nursing homes.
With this announcement, I'm using the power of the federal government as a payer of health care costs to ensure we reduce those risks to our most vulnerable seniors.
He says all staff have to be vaxxed against COVID if they receive Medicare or Medicaid funding. It could take effect as soon as September. On today's Ask the Expert, we're joined by Brian Levy. He's the Director of Marketing and Business Development at Cambridge Caregivers, Manchester Care Homes in Dallas. He is in the KRLD Zoom room. This seems a long time coming because nursing home staff vaccinations have been real low.
They have been low, but we're almost back to ground zero, and it's scary times. And as much as, David, as I mentioned, it's a political question and it's an opinionated question. But I got to tell you, as a company, we're all for it. We don't take any government funding. We don't take Medicare or Medicaid. We're all private pay. But just in general, let's be smart. And if it takes the government to tell us to wear a helmet or a seatbelt or shirts and shoes in the 7-Eleven, put a mask on, for crying out loud. Get vaccinated.
Elderly people, to a person, upwards of 90% vaccinated in a lot of cases. They were the first ones to get vaccinations as well. And if they're living in a long-term care facility, they can't feel safe if the people that are taking care of them aren't vaccinated.
No doubt. These frontline workers, they're not invincible. And when, a caregiver gets vaccinated, that's just, it's not a force field. It's just, it's a deterrent, of course. But, with the new Delta variant and who knows what's next, mask up and wash your hands with soap and water.
Will other companies follow the rules and say, yep, we're going to make sure all of our staff is vaccinated? How are they going to know?
I would hope so. I don't know what the penalties are. I don't know how they're going to be able to enforce it. But, like you said, this group of elders, they're very, very susceptible to any kind of illness. We've been masked this entire time at Manchester Care Homes. We haven't taken masks off, and we're not going to do it anytime soon.
Are other homes and long-term care facilities showing at least the need for all of their employees to be wearing masks as well?
From what I've seen, some are and some aren't. Some take it seriously, and some just say, oh, it's just like the flu, don't worry about it. But I got to tell you, we are taking more precautions now than ever. And that's even where we're starting to do a survey on visitors and vendors. Nobody's allowed in the house that hasn't been vaccinated, family included, and masks, hand washing, the whole 9 yards.
Is it also going back to the pandemic itself, in the early days of the pandemic, where you had to set up appointments and you could not necessarily see grandma and grandpa face to face in a lot of cases? It's
not out of the question. Whatever it takes to keep our care homes COVID-free. We've been COVID-free for 20 months now, and we're not going to take any undue risks now. I can't stress it enough. Mask up, be smart. Back to the caregivers that are working in the care homes, when they leave a shift and they go pick up their kids at daycare or go to the grocery store or carry on with their normal lives, they still come back into the care homes. And so we educate them to be just as cautious when they're off duty as when they are on duty. What
has taken so long for long-term care facilities to be put into this, where they have to be vaxxed and masked?
Probably pressure from families, pressure from the media, politics, all the wrong reasons.
Brian Levy is the Director of Marketing and Business Development for Cambridge Caregivers and Manchester Care Homes.